Hello, 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 and welcome back to your public health community safe space where meaningful conversation is the aim. Today we have a lot to discuss. We're continuing with the conversation on oral health, but we're going to take it in a different direction. Today it's an overcast day, but we have much to speak about, and oral health is our concern. Community and public health is what we thrive for. So today we're going to start off by just defining some terms, explaining the direction, and picking up on the cues that will lead us towards our topic. Let's take a look at what we're viewing today. Isn't it wonderful? Yes. So on today's journey, we want to discuss oral health, and we're going to continue by making sure that our interests are served. What if I was to tell you that bad breath isn't about hygiene, not about garlic, not about coffee, not about even forgetting to floss? What if it's an infection? Yes, an infection. And what if that infection came from oral intimacy? Yes, I said it. Oral intimacy. Many people tend to normalize oral intimacy. They call it low risk, and they rarely connect oral intimacy to oral health. But your mouth is a living tissue. It absorbs, it responds, and it gets infected. And sometimes your breath is the first warning. Stay with me today, because what I'm about to explain could change how you think about oral health forever. With that said, the topic, can you think of it, is bad breath or an STD, the hidden symptom of oral intimacy. Let's start talking. Let's go. So, as many people may classify this, they classify the illness that can come from oral intimacy as the silent mistake. And here's why. Many people with persistent bad breath, I'm not talking odor because you didn't eat, I'm talking that persistent bad breath. Many people with that, they usually react to it by buying stronger mouthwash, chewing gum, scraping their tongues, or the normal response is to blame yourself. Blaming yourself is the general go-to. But meanwhile you're blaming yourself, what we notice is the real issue is sitting in your throat. It's sitting there silently. It's going undiagnosed. It's transmissible. And there is no connection that usually exists between sexual health and oral health. This is where sexual health and oral health collide with these symptoms. Oral intimacy exposes the mouth to bacteria, viruses, bodily fluids, and microbial shifts. Your oral microbiome is delicate, very delicate. And when new pathogens enter your throat, they can disrupt the natural order of things. It can trigger infection, cause inflammation, produce pus, or increase sulfur-producing bacteria. It is this sulfur-producing bacteria and sulfur compounds that create that strong, persistent odor. Brushing cannot fix an infection. Treatment does. Now we're going to shift the conversation a bit, and we're going to discuss 4 infections that can affect your breath. And what we're going to do, I'm not going to go deeply into these 4 infections, but we're going to try to link the commonalities between these 4 infections. We're going to start with gonorrhea, specifically oral gonorrhea. And what we see here is sore throat, pus, odor that doesn't go away with brushing. We shift, secondly, to syphilis. The issue here is oral sores, tissue breakdown, odor, that can develop based on what we've discussed. That's sulfur. The tissue breakdown can create secondary infections, which is expected. We develop an odor, and sometimes we have ulcers that look harmless. It may or may not be, but we always recommend getting tested. Third, we go to herpes simplex. The issue with that we're looking at is painful blisters, open ulcers, inflammation, and again, odor. With ulcerated tissues developing from herpes simplex, it allows odor-causing bacteria to thrive. Herein lies our problem. Then finally, let's look at HIV. The issue there becomes gum disease, thrush, and sulfur odors. Necrotizing infections will help to advance gum infections. So the similarity that we notice and can observe from these 4 infections have to do with odor. All 4 has odor at different levels, and we can also say it depends on your health, your immune system, and how your body reacts to these infections. We're looking at some red flags. So although we've discussed the issues generally, we're going to give the warning, and I'm going to let you know that if bad breath is the issue, it is not uncommon for you to have certain things, and I want you to pay attention to this. Persistent sore throat, white patches, pus, a metallic taste in your mouth, swollen glands, bleeding gums, or just oral sores. Now, the concern is especially seeing these things after oral intimacy. We're having this discussion, and it's not about shame. And I pause to make this point. It's not about shame. It's not about creating fear. It's about creating awareness. Once you are aware of something and aware of an issue that does exist, then you're able to get treatment. You're able to counteract whatever it is that's going on with you and in your body. And this is the goal. This is what I want you to achieve. A level of awareness that makes you capable of seeking the care that you need. We are here to advocate for each other and to better serve our communities. And how can we serve our communities if we're not healthy, if we're not informed, if we're not aware? There's a persistent myth that oral intimacy carries no risk. We want to dispel that. That is not true. The behavior itself is not new, but misunderstanding the risk can create gaps in care and health prevention. Public health challenges in regards to this conversation often grow quietly, not dramatically. We see the concern once the numbers are made public, but it's not a dramatic growth, it's a quiet growth. And that's why I advocate for self-care and preventative care. Now, I've had some common questions that I've come across, and when we put the information out, there are certain things that people want to ask, and a lot of this tend to come from older teenagers or younger adults. And let's cover a few. There are many questions, but I chose to take about 5 of them out. So let's cover these 5 questions. The first one is, can you have an STI in your throat and feel completely fine? Yes. Many throat infections cause no symptoms. And this is where it's good to get your routine checkup. This is where we had the discussion about your dentist as an oral advocate. You could go back and watch the video. Your dentist as an oral advocate, going to your clinic appointments twice a year is important, because these are the things that they talk about. These are the things that they can identify. Our second question is oral intimacy safer than intercourse? When it comes to considering HIV, the risk can be lower. but we will never say it's safer. For herpes, syphilis, gonorrhea, and HPV, transmission is possible. Our third question, should throat swabs be part of the STI testing? If you engage in oral intimacy, discuss throat testing with your provider. So not just your dentist, but your general provider, your normal everyday doctor visit is important as well. And oral health lies between both places. Does protection reduce risk? Barrier methods like condoms and dental dams significantly reduce the risk, but nothing is 100% proof. Nothing can guarantee that your intimate contact with others is without risk. And that's why I will reiterate, after all these questions, I will reiterate that we get tested. Finally, the final question is, why isn't this talked about more? Well, the obvious answer is the stigma that goes with it. Many people are embarrassed to discuss odor with someone who they identify carrying an odor. They're embarrassed, and some people just don't want to have the conversation because they don't want to let that other person feel uncomfortable. But as I said, it's not about being uncomfortable, it's about being aware. A lot of times I notice that patients are not aware of their own odor. They're so used to it, it's been a part of them for a while, that they recognize it as normal. So we'll say here that the public health message historically has been focused mostly around HIV prevention and protection, but the broader STI discussion and education around oral transmission has been less emphasized. And so having this walk and this discussion brings that to the surface and makes it easier for us to understand why it is important to have these conversations. Now, I want to take a moment and I want to acknowledge that I appreciate you being here, and there is no embarrassment or shame. So if you've ever had a health symptom that turned out to be something completely different from what you were expecting, if you ever went to the doctor and you thought, I'm experiencing this, it has to be this other thing, and the doctor goes, no, or the dentist says, no, you have something completely different, then I want you to write health wake up in the comment section. I want you to let us know that you're here and you understand. Also, don't forget to subscribe and like and share, because these topics are meant to inform, educate, and to help you advocate for yourself. Okay, so if you are identifying a problem, if it's the slightest change in how you normally function or see yourself or how your body reacts to things, I advise you to take it up with your doctor, take it up with your dentist. They are there to help you understand and prevent any further decrease in your lifestyle or health choices. So, because awareness saves time, then we also know that awareness saves health. Here's what we don't say loudly enough in public health. People are embarrassed about bad breath. And so in public health, we don't tend to have the discussions that many will deem embarrassing because we don't want to embarrass anyone. As I said, it's not about embarrassment, it's about awareness. So have the discussion. Have it with your friends, your family, your co-worker, your neighbors, your children. It is important. And I think having these discussions shows each other, shows the community that you do care. And caring is what our focus is. Now, I want to pause for a second and to address something that someone asked. They said, why aren't you in a suit, in full makeup, sitting behind a desk in an office and talking about these issues like most doctors do or most professionals do? And my answer to that question is sitting behind a desk in an office does not get me to get to the people I need. I need for my viewing audience to feel comfortable, to feel like they're looking at somebody that looks like them, someone who could relate to them. And that's why I said I'm keeping the conversation light with its simplest form. Of course, I have to give you statistics and I have to use some medical jargons, but in cases where I can break this down, I will. And I started making it accessible and making my audience feel comfortable by just what they see. And what they see is important to build trust. So me being dressed down doesn't dress down my education or dress down the information that I want to give to you. It's just to make you a bit more comfortable. Okay? So let's continue with our discussion. We're almost there. Now, as I said, many people are embarrassed about certain discussions, especially those built around STDs, because a lot of times they think people are going to assume that they're living a risky life, and that should never be the case, and that should not be the assumption. Medical professionals are supposed to empathize and listen and care for you, and as always, be your advocate. And if you don't get that from your medical professional, try to get a second opinion. Find someone who makes you comfortable, someone who you're able to trust and speak with. So the embarrassment around STD should not be something that is the norm. Do not accept it, seek care, but do not be embarrassed. We want you to be aware. Based on that embarrassment, we notice a lot of people stay silent. They delay getting diagnosed. And with silence, it leads to the spreading of the infection from one person to the next. Silence turns treatable issues into complicated ones. So you not addressing whatever is going on with you complicates and compounds the issue and spreads the infection. It's important for us to understand, and I will stand on this. It is very important for us to understand that your mouth is part of your sexual health. Let me repeat. Your mouth is part of your sexual health. Ignoring symptoms does not protect you. Testing does. Sometimes, of course, bad breath comes from dehydration. Sometimes it comes from poor hygiene. But sometimes, just sometimes, it's your body asking for medical attention. Again, this is not fear-based. This is awareness-based. This is power-based. So if this conversation made you uncomfortable, good. Because then it opens your eyes and it creates the conversation and give you self-analyzing moments. And I want you to analyze yourself. I want you to think. I want you to ask the questions that nobody is going to ask you because they are not aware of it. Make that appointment. See your provider. See your dentist. Become more concerned with your health and your lifestyle choices. Public health should make us think. I am here to make you think. So if this is making you think, what I want you to do, share this quietly with someone who needs it. Even if you're not aware of them needing it, share it. Information is power. Knowledge is power. And the more we learn is the more we grow. Be motivated about the actions that you should take for a healthier and better lifestyle. I will return with more topics and we will continue to have the discussion in the comment section. And I should say preemptively, I am so proud that you're able to take the steps necessary and you're willing to have this conversation with me and take this journey. I'm here for you. This is about you. This is about public health and making better lifestyle decisions. So until our next conversation, I want you to stay motivated, stay encouraged, and know that awareness is power. See you in the next one.